Hi friends, good evening. Once again, welcome back to my channel Mukambika Nursing. Friends, here we are discussing questions for ESIC exam preparation. Also, these questions will helpful for your RRB exam, DME exam, Kerala PSC, also NVS Navodaya Vidyalaya exam preparation. We can see the questions. First question, which is called gateway of pain according to principle of pain sensation? Options, option A spinal cord, option B hypothalamus, option C brainstem, option D cranial nerve. Here the question is the gateway of pain. Which body part is known as the gateway of pain? And the correct answer is it is spinal cord. Option A is the correct answer. According to gate control theory of pain, the pain signals are not free to reach the brain as soon as they are generated at the injured site. So what the theory says, the pain which is formed at the injury site is not immediately reach the brain. Okay, they need some neurological gate. The pain which is formed at the injury site, they need some helps to go to the brain. They are the neurological gate. They are formed at the level of spinal cord. Okay, so the correct answer is spinal cord. Move on to the next question. A lesion in occipital lobe of cerebrum affects options. Option A vision, option B speech, option C hearing, option D personality. The question is lesions or injury in the occipital lobe of cerebrum or occipital lobe of the brain which affect vision. Option A is the correct answer. We can see the location of different areas in the brain. So here first is visual area which is located at the occipital lobe. That is our question. Okay, lesion of occipital lobe leads to visual changes. And the next location of auditory area and also olfactory area is at temporal lobe. Okay, and gustatory area and somatory sensory area is located at parietal lobe, and location of primary motor area is at frontal lobe. Okay, so the occipital lobe, location of visual area, temporal lobe, location of auditory and olfactory area, parietal lobe, location of gustatory area and also somatosensory area, and frontal lobe, location of primary motor area. Move on to the next question. Which cortical area is responsible for formation of speech? Options, option A cerebellum, option B hippocampus, option C Broca's area, option D hypothalamus. So the speech regulatory area or the speech formulation of speech area is located at Broca's area. Option C is the correct answer. Broca's area which control the speech, this area is located at the frontal lobe. That is also important point. Broca's area is located at frontal lobe. Move on to the next question. A space occupying lesions in the left frontal lobe of the brain can cause. Options, option A receptive aphasia, option B expressive aphasia, option C seizures with a visual aura, option D none of this. Question, lesions or injury in the left side frontal lobe of the brain can cause or can leads to option B expressive aphasia is the correct answer. Option B. So what is aphasia? Aphasia means inability to speak or understand spoken words or language comprehension or language production. So that is aphasia. Aphasia means inability, person can't able to speak or person can't able to understand spoken words. That is known as aphasia. Aphasia is two types. First one is expressive aphasia and second one is receptive aphasia. So expressive aphasia is also known as Broca's aphasia. It means inability to understand spoken words. Okay, so expressive aphasia means inability to understand, or person can't able to understand spoken words. It is due to defect in Broca's area of speech in the left frontal lobe of brain. Okay, so the defect of left frontal lobe which may leads to expressive aphasia. And the second type is a receptive aphasia. Receptive aphasia or Wernicke's aphasia. Okay, it is also known as Wernicke's aphasia. It is due to inability of the client to understand spoken and written words. Both spoken and written words can't able to understand both spoken and written words. It is mainly due to defects in Wernicke's area of temporal lobe. Okay, there are two types of aphasia, expressive and receptive aphasia. So our question was, lesions in the left frontal lobe of the brain can lead to expressive aphasia. Okay, option B. Move on to the next question. Complete loss of language comprehension or production is called. Options: option A, dysfluency, option B, aphasia, option C, dysphagia, option D, dyspraxia. Question is complete loss of language comprehension. That means the person can't able to speak or can't able to understand the words or language is known as we already discussed in the previous question, it is known as aphasia. Option B is the correct answer. And the next question, loss of ability to recognize objects are called. Options: option A, agnosia, option B, aphasia, option C, apraxia, option D, amnesia. The question is loss of ability to recognize object. The person can't able to understand or can't able to recognize the objects are called agnosia. Option A is the correct answer. For example, inability to understand sensory information, that is touch, sense related information, words, sound, that is inability to recognize objects. Object means anything. Okay, that is known as agnosia. And option C, apraxia. Apraxia means inability to perform purposive movements or activity, that is known as apraxia. And last option, amnesia. Amnesia means absence of memory. Move on to the next question. Loss of muscle coordination results from damage to. Options: option A, hypothalamus, option B, cerebrum, option C, cerebellum, option D, midbrain. Question is, muscle coordination difficulties result from damage to cerebellum. Option C is the correct answer. Move on to the next question. Respiratory center is located in which part of brain? Options: option A, medulla, option B, pons, option C, hypothalamus, option D, cerebellum. A respiratory center is located in medulla oblongata. Option A is the correct answer. Both cardiovascular and respiratory center is medulla oblongata. Here respiratory center, suppose cardiovascular center if it is the question, that also medulla oblongata. Okay, hypothalamus, option C, is the temperature regulatory center. Last option, cerebellum. Cerebellum which control muscle tone and posture. And the next question, eating behavior is controlled by. Options: option A, hypothalamus, option B, adrenal gland, option C, pancreas, option D, medulla. Eating behavior is controlled by hypothalamus. Option A is the correct answer. Important functions of hypothalamus we can see, heat regulation or temperature regulatory center is hypothalamus. Also drinking behavior is controlled by hypothalamus. Thirst center is located in hypothalamus, or thirst center is controlled by hypothalamus. Also circadian rhythm is maintained by hypothalamus. And also emotion, regulation of emotions, all controlled by hypothalamus. These are all important points. The next question and last question, Brucellin test is used for the diagnosis of. Options: option A, typhus fever, option B, leprosy, option C, brucellosis, option D, mononucleosis. Brucellin test is used for brucellosis, used to diagnosis brucellosis. Option C is the correct answer. Today's all questions are from previous year question papers. Surely these questions will helpful for your exam preparation. If it is useful for your studies, please subscribe my channel and share my videos to your friend circle.